Now, I want to jump in really quickly with some questions from people out there that I threw out into Instagram. And I know you're big on Instagram. I love your stuff. I follow you all the time. But I want to hit you with these, and you don't have to go into in-depth answers here. It's kind of like a
Rapid
quick answer
fire.
here. Yeah. What do I do for itchy gums? One person asked.
Itchy gums. Yeah,
Itchy gums.
skip all the chemicals and look into coconut oil pulling. That's the first start, and into a natural toothpaste, and then gum health. Look into vitamin C, collagen, and maybe vitamin D3, of course. Yeah, those are like quick rapid fires.
Good, good. Can you strengthen weak teeth or even reverse cavity damage?
Yes, you can. Cavity damage depends on size. If it's in the enamel called initial cavity, yes, you can by implementing the right nutrition, protein, 2 grams per kilogram body weight, and then go with vitamin D3, vitamin K2, magnesium, and all the other minerals that you can find in my bone healing protocol. So that you get your vitamin D3 level above the norm, which should be above 60 nanogram to 100 nanogram per milliliter, not 30 to 60.
Mm-hmm.
Add on vitamin K2 and magnesium as cofactors, and omega 3s, maybe. Yeah, this you could do. This you can do to really strengthen your teeth. Basically, you will nourish your saliva, but also nourish your pulp from the inside, and then you rebuild, because you can see teeth kind of like as a maybe you could say a storage unit for minerals in your body. And if you have a lack of minerals in your body takes it from the teeth and from the bones. You kind of like cavities are kind of like osteoporosis of your teeth, just saying. So think in terms of minerals, and for mineral uptake, you need vitamin D3. This is why I brought up. And of course, you need proteins for the enzymes and stuff.
Let me ask you, this isn't one of the questions, but it just brought up in my head. What do you think of the new toothpaste with hydroxyapatite? With that, they say it's a, what is it, a mineral calcium apatite that's supposed to remineralize enamel, and I think there's
I don't know if they're new. So I think they're there for
okay.
years. Hydroxyl appetite. I think it's something organic, and I wouldn't have a problem by using it if it's fluoride free and if it's in a natural
Hmm.
toothpaste. I think that your teeth are naturally hard as stone. It classifies in this. It's in the same category as granite or granite.
Hmm.
So it should be hard as stone, and at the same time as sensible to touch a hair. It's really a fascinating organ. So if you have the nutrients from your diet and maybe from fine tuning with supplements, I think you don't need it, because you will have it from the nourishment. Then you probably don't need the hydroxyl appetite. But maybe as a first aid strategy, if you have sensitive teeth, to build up, it could work. But I would always do it in conjunction with what I just said: protein and the critical three, vitamin D3, K2, magnesium, at least. Why not more? Yeah? Like the bone healing protocol there's everything in it, like even activated B vitamins. The SNPs are covered. Boron is in it. Zinc is in it. So it's
Mm.
like it's kind of like synergy. Nutrients working, micronutrients work in synergy, like a soccer player team or football player team,
Yeah.
or basketball player team. You need everybody on the team. You cannot win without anybody. So it's not one thing that blocks anything. It's the whole approach.
Right. What are your thoughts on xylitol gum and mints?
Like it. Xylitol, fine. It is birch. If it's from birch, it's birch sugar.
Hmm.
Actually, yeah, can you say carriers bacteria, Streptococcus mutans and stuff? They eat it, they feed on it, they die from it. So it's a good strategy. I like to chew gum from time to time. We have one in my store, which is xylitol, and it is without titanium dioxide. The other one you have to look for, because gum already is white. Most of the gums you find out there, which are full of sugars and white coating, are toxic for you. Don't chew those gums. Really be careful with what gum you chew. And xylitol ones, maybe a natural gum source, is good strategy. And I think you have more available in the US than we have in Europe.
We have a number. I use a few different. I've seen people posting about it, and yeah, I enjoy it more so, of course, than regular gum or other mints out there. Or otherwise, just use peppermint oil if your breath is something that,
I love peppermint oil. Yeah,
right. It's strong, strong. One drop, and boom, it'll wake you up.
Yeah, I do. I sometimes just drink like a jug full of water. And this one, for example, I just had in a 1 drop of lemon essential oil. 1 drop, it's so good. And I do the same with peppermint at times. And peppermint is always 1 drop is in my coconut oil pulling recipe.
Awesome.
So it's really good.
I'm going to hit you with 2 last questions here. Do you ever feel implants are contraindicated if a person is really sick?
It depends on what implants. So titanium implants are 100% contraindicated, or if you have them, you should really look into getting rid of them because it's metal. Ceramic implants, however, are a tool to stabilize bone and tissue and keeps you biting, and zirconium dioxide is a ceramic. It's not a metal. It is totally electrically neutral, and according to Dietrich Klinger, it is actually a healing stone. And you could activate it by using red light therapy on it, or low-level laser therapy, light to it, so that it really heals and activates the jawbone and helps you, and especially chronic patients, to keep their jawbone and their bite height. Because if you lose bite height, you basically get old and your brain doesn't work anymore, your lymphatic system dies. So here is where the outlet is, like the TMJ joint is kind of like where everything comes out and in from your brain, outside and inside, the whole blood supply. And there's a study showing if you have only 1 millimeter of tooth height loss because of grinding, chewing, and lots of different things, you lose 50% of the blood supply to the brain and 50% of out of the brain. So you cannot really detox anymore. One strategy is to get like a splint to open it up at nighttime, kind of like sleep like this with an open mouth, just to detox better. And so, yes, implants are kind of a healing device. We call them bone growing implants, actually. Ceramic.
And it's crazy.
You have to know how to work with them. It's not about the implant. This is just a part of it.
And the fun thing I learned about ceramics, you're right, it is healing. And I'm seeing that a lot of companies now are using even 3D printing of ceramics for EMF protection and solutions, and trying to basically, create vortexes that negate negative EMF, radiation. So there's another great ceramic use. So ceramics are healing for sure.
Yes, ceramics, a bunker would be made out of ceramic if possible.
Yeah.
This is also the problem with the cone beam. The radiation doesn't go through a zirconium implant. So it's all scattered on a cone beam later on. You cannot diagnose it afterwards. So if it's installed in your mouth, you need an MRT if you want to find some structures. But normally, if you do it correctly, a ceramic implant will perfectly be just osseointegrated into your whole body if your body is able to build bone and tissue. This is why nutrition and all these other parts are so crucial to overall healing. And this is why it's not about the implant. I tell it to my dentists that are at the beginning of their training. It's not about the implant. It's about the optimal health for your patient. You need the implant to restore the bite and to help with the tissue to preserve the socket. But don't think about selling implants and stuff. It's not about that. It's about optimal health for your patients. It's a challenge.